My name is Christopher Rusk, and I'm the manager for Valley's Recovery and Wellness Unit here on the Ridgewood campus. We're here today answering questions from the community. So the first question we have here is, what is Valley's Recovery and Wellness Unit? So we're a specialized inpatient unit on the Valley Ridgewood campus known as a withdrawal management unit. Withdrawal management is the process of safely and effectively helping individuals manage the physical and psychological symptoms that occur when they stop using or reduce their intake of a substance they've become dependent on. This substance could be drugs, alcohol, or even certain medications. Withdrawal can pose serious medical risks. Some could even be fatal, particularly if withdrawal is attempted suddenly or without the proper supervision. Having individuals undergo withdrawal management in a specialized unit staffed by clinical professionals is essential for ensuring their safety and well-being. Second question we have here is, how does the program support patient during and after treatment to maintain long-term health improvements? Quality treatment starts with a comprehensive assessment to determine the patient's needs. There are many ways that people can develop substance use disorder and many paths to recovery. So we start with a very thorough biopsychosocial to identify what are some of the issues beyond the medical. This could be emotional, social, family, and spiritual domains of their lives. And what we really want to look at is how the life domain impacts the development of substance use or the continuance of substance use, and then also how the substance use has impacted the life domain. And what we really want to do is work with the patients to help them identify their strengths, needs, abilities, and preferences, and work collaboratively with each patient to make a truly personalized plan to help them move forward in their recovery journey. When you think about it, the patient is actually one of the most critical people on the treatment team. They're the expert on themselves, and really setting up the right aftercare and linking patients with resources in the environment is essential to help maintain their sobriety in the community after this initial acute phase of recovery. Patients coming in with us, they really have a lot of things going on in their lives. Their stressors are pretty much at their highest, their coping skills may be at their lowest, they may be cut off from resources or supports in the community, and now what they're looking to do is they're looking to set aside what may be their only coping skill and source of relief and make some very, very challenging lifestyle and mindset changes. That can be an extremely daunting task. And so some of the evidence-based modalities we use to really help support those patients, one would be motivational interviewing. And this is something that helps patients to resolve their ambivalence about making these difficult changes under very challenging situations, connect with their internal motivations to create change. We also use cognitive behavioral therapy modalities to help patients start to utilize and develop specific coping skills that are going to help them move forward towards the next stage of their recovery. One of the other elements that's critical to the success of our program is that we can provide group and individual therapy to deliver these different evidence-based modalities we just described. As you might imagine, all of these different elements require an integrated multidisciplinary team. At the core of that team is the attending provider, the doctor who works closely with specialty trained nurses. We have full-time social work to be able to deliver these additional therapies. There's also access to specialty care. Could be wound care, PT, OT. Patients can have access to psychiatry should they need it. Essentially anything that they need to address additional medical or needs or complications they may have during their visit. So another question here is, what makes this withdrawal management program unique or different from others available in the community? That's a great question. And I would say the first thing that we have here that makes us unique are the people. The teams here at Valley and the extremely talented professionals we have the privilege to work with and work beside every day, they really do make all the difference. Valley is an amazing health system, and we're really pleased to be able to offer this service line. The second thing I would say is our nursing ratio. It is absolutely second to none. We have a 4-to-1 nursing ratio. That provides a lot of one-on-one support and attention. And in addition to the highest quality of clinical care that all Valley Health System nurses provide, our program integrates additional holistic nursing modalities like the clinical application of essential oils, therapeutic massage, mindfulness practices, and a focus on truly connecting and engaging and supporting the patient in their recovery journey. I will say it's not uncommon to walk by the rooms and see that maybe a nurse has pulled up a chair. They're sitting with the patient. They're speaking with them. They're encouraging them. They're learning more about their story and really helping them through this very challenging short-term part of their recovery. Now that speaks really to our philosophy of care. Our focus here at Recovery and Wellness is on the overall well-being of the patient. We focus on them achieving wellness, not just focusing on their illness. Valley delivers care like no other, and that certainly applies to how we address substance use disorder at our withdrawal management unit here at Recovery and Wellness. One of the other questions here was, what are some of the expected benefits or outcome that participants can expect from completing this program? This is a great place for us to kind of summarize a little bit about what we've been talking about. Obviously, the first order of business is to help patients withdraw safely and comfortably, making sure that all of their medical, clinical, and social supports are in place. The second part of what we really want to expect is that patients are going to be able to identify their own goals, help to leverage their strengths, identify their needs, their abilities and preferences, and create that proactive solution together with us based on what each patient is really ready, willing, and able to do, and what their needs are in the community. And that's where that connection to aftercare is absolutely critical. We work with each patient to connect through case management, through our social workers, with their internal and external resources to help them achieve and maintain their sobriety in the environment and in their community. Each patient's needs are really going to be very unique, and what we really want to look at is how we can connect them. Some patients may need, for example, short-term residential afterwards if they have significant problems maintaining their sobriety in the community. Others may do well with some outpatient or working with an individual therapist, seeing a psychiatrist, maybe taking some medications to help them address co-occurring mental health symptoms, or medications to help them manage cravings, or even some combination of all of these. But we deliver the person-centered care that really helps to create a unique recovery and wellness plan for each of the patients that come through our unit. So a final question here is, how does this program address the specific health concerns or needs of our community? Looking at the community health needs assessment, the last one that was conducted in Bergen County, 82% of the people surveyed considered substance use to be a problem in their community, and over 46% felt it was a major problem. The Department of Mental Health and Addiction Services here in New Jersey, in their last assessment of Bergen County, showed that only 30% of people who felt they needed treatment for substance use disorder received it. That's 70% of people in Bergen County that did not get the help they needed or wanted for their substance use disorder. The Community Health Needs Assessment also determined that a major contributing factor to this was lack of care, especially when patients are at a moment of readiness to change. That might be a very narrow window, and the ability to connect with a structured care quickly is critical. The Valley Hospital is proud to announce the opening of this specialized unit to help meet the needs of the community we serve. This is why we emphasize a streamlined access to care right away. Patients or family members can call us 24/7 to get more information. We can provide an immediate screening and walk them through the next steps to admission. And we can admit patients to our program 24 hours a day, 7 days a week. Now, withdrawal management is a critical first step in anyone's recovery journey. And our program is designed to help patients get through the complex and challenging acute phase of recovery, while also identifying their specific needs and designing a personalized plan for them for the next steps in connection to resources that will support their personal recovery goals and support positive long-term outcomes. So for more information, the easiest way to contact us is go to the Valley homepage and just search for Recovery and Wellness. Please reach out if you have any questions, and we're looking forward to serving you in any way we can.